Today I'd like to talk about scaling, dental cleaning. For a healthy person, this applies at least once a year. If you've been prone to tartar buildup since childhood, you should definitely watch this. If you were born with weak gums or have experienced gum disease in the past, you should consider the possibility that you may have a higher chance of needing dental implants. This is because the mineral content in your saliva may be higher than that of others. As a result, tartar builds up more quickly than in others, and the viscosity of your saliva significantly affects this process. Simply put, if your saliva is slightly stickier than others, tartar will accumulate at a faster rate. And if you have malocclusion, meaning your teeth are misaligned, there will naturally be more hard-to-reach areas where brushing is ineffective. These areas are more prone to tartar buildup, causing it to accumulate even faster. When food debris continues to accumulate in areas that cannot be cleaned with a toothbrush or dental floss, it eventually combines with components in your saliva and starts to harden. Minerals like phosphorus and calcium in your saliva bond with leftover food particles and bacteria in your mouth, forming hardened tartar. Tartar is essentially a mass of bacteria. When bacteria enter our body, an inflammatory response occurs. Tartar accumulates along the gum line, and this bacterial buildup triggers inflammation in the gums. In its early stages, gum inflammation, gingivitis, may appear as minor bleeding while brushing. However, if gum inflammation is left untreated for a long time, it progresses into periodontal disease, which begins to erode the bone inside the gums. As a result, the gums gradually recede. When this happens, the tooth roots become exposed, leading to tooth sensitivity. Additionally, a condition known as the black triangle can occur, where receding gums create dark gaps between the teeth. Of course, this also negatively affects the teeth, and tartar continues to build up in these areas, creating a vicious cycle. If the gum bone deteriorates significantly, it will no longer be able to support the teeth, causing them to become loose and unstable. Eventually, this leads to tooth loss, requiring tooth extraction and, in many cases, the need for dental implants. Now, everyone, what is the worst-case scenario when you have gum disease? Losing teeth and needing dental implants is serious, but an even more critical issue is the fact that tartar is a mass of bacteria. The worst-case scenario occurs when these bacteria enter the bloodstream through the gums and circulate throughout the body. This can worsen conditions such as diabetes, high blood pressure, stroke, Alzheimer's disease, and even pneumonia. Additionally, for pregnant women, having gum disease increases the risk of premature birth. Pretty alarming, right? This is exactly why the South Korean government supports scaling costs to help prevent gum disease early on. So how many times should you get scaling per year to effectively prevent gum disease? Let me break it down based on different situations. If you are in your 20s or 30s, have never experienced gum bleeding while brushing, and have never had swollen gums, then once a year is enough. In this case, you can simply take advantage of the annual insurance-covered scaling provided by the National Health System. I have emphasized that you should get scaling at least once a year. In the next session, I will provide more detailed information on dental care. This has been Dr. Ryu Seong-hoon from Balance Dental Clinic at Pangyo Station in Korea. Thank you.